Hey there, viewers! Everyone wants to stay away from germs, especially during the pandemic. Your toothbrush needs particular care. In today's video, we'll discuss how to take care of your toothbrush during the pandemic. Does boiling it make it germ-free? What's the best place to store your toothbrush? We're talking all that and more. First, why should you clean your toothbrush? Your mouth is filled with bacteria from the moment you wake up. I'm talking about your teeth, tongue, gums, and soft tissues. Everywhere, folks! Ever notice how fresh your breath is after brushing? This is because a lot of the bacteria has been cleaned from your mouth. But while a lot of it goes down the drain, some of the bacteria stick to your toothbrush. Bacteria stick to everything they come in contact with. Your dental floss and retainers are also affected. People have become extra paranoid of germs and bacteria since the COVID-19 pandemic started. How often do you clean your toothbrush? Sound off in the comments below and start a conversation with our Bestie community. Here are some of the best ways to disinfect your toothbrush during the pandemic. Number 1. Hot water. Before putting on toothpaste, make sure to wash your brush under hot water. And I mean really hot water. Lukewarm water just won't cut it here. Hot water helps get rid of the bacteria that may have been sitting on the bristles since the last time you brushed. You may even be able to get rid of those nasty food particles. Your brush is now sanitized and ready to take down more bacteria from your teeth. After brushing, run it again through hot water gently and wash the bristles with your thumb. Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all our great Bestie content. Number 2. Soaking. Mouthwashes are great for getting rid of that plaque and foul odor from your mouth, but this cleanser may have the same effect on your toothbrush. It's a cost-effective way to disinfect your brush. You can mix half mouthwash and half water in a small cup. Dip the head of the brush in this solution and let it sit for at least 2 minutes. Do this right after you've brushed. Using mouthwash can make your toothbrush squeaky clean. It may even smell fresher after you remove it from the solution. Just keep in mind that the chemicals will wear your brush out quicker. Number 3. Boiling. I know it sounds weird, but it works. You can boil water in a pot on your stove, turn down the heat as it boils, and dip the head of your toothbrush in for 30 seconds. This should kill the bacteria pretty quickly. Just remember not to do this with electric toothbrushes. That's a quick way to ruin your brush. Before we continue, we here at Bestie specialize in so many topics. Check out 16 unusual restaurants from countries around the world. Number 4. Denture cleansers. Our markets are loaded with over-the-counter denture cleaners. There's a wide variety of flavors. You can use a denture cleaner in the form of tablets or liquids to clean your toothbrush. They have an antimicrobial effect and will free the toothbrush of plaque and bacteria. Never use the denture cleanser tablets that have already been used once. Chances are it would lead to cross-contamination and bacterial transfer. Take half a cup of regular tap water, drop a tablet or liquid into it. Dip your toothbrush for 90 seconds or so and make it extra clean. Make sure you use fresh water and a denture cleanser each time. Get rid of the mixture once you're done. Number 5. UV sterilizer. This is a pricier way to keep your toothbrush clean. Not everyone has access to it. After you're done brushing your teeth, place your brush in a room with UV light. You can get a family-sized box or even a travel kit to sterilize your brush when you're on the go. You're going to have to spend some money, but just imagine the convenience you'll experience. It requires almost zero effort on your part. Studies have shown that using UV light is more effective in disinfecting brushes than mouthwash and salt water. Just be sure the light doesn't hurt your skin, as it may cause skin cancer. So how do you disinfect your electric toothbrush? Powered toothbrushes are delicate and must be disinfected with extra care. It's very important to keep the electronic panel away from water and harsh cleansers. They will mess it up in a big way. You can sanitize your brush by detaching its head from the base and cleaning it by any of the methods we discussed earlier. However, if your toothbrush does not separate from the base, you'll have to choose between water cleansing or dipping it in mouthwash solutions. How do you make sure your brush remains clean at all times? Disinfecting the toothbrush is just one part of it. The other part is maintaining its cleanliness. So how do you do that? Number 1. Hydrogen peroxide. This liquid is already a powerful cleanser for windows, household devices, and even furniture. Hydrogen peroxide is extremely versatile and can also be used to clean your toothbrush. Studies have shown that hydrogen peroxide reduces the bacteria on your toothbrush. This is such an affordable method to clean the dirt growing on your brush. You can use it every day. Take a small cup and fill it with hydrogen peroxide. Put the bristled end in first. Let the brush sit in the solution. Make sure to change the solution every day. Number 2, have a personalized storage system. Do you have a large, family-sized holder where everybody places their toothbrush beside each other? Your brush will be loaded with bacteria. Get a personalized cup for every family member and keep them away from each other. This will reduce cross-contamination and keep your mouth healthy. Number 3, keep it away from your toilet. We generally have a habit of throwing our toothbrushes beside our toilet on the top of the sink. It may seem like the most convenient place to keep it, but it actually may be the most dangerous. It's believed that if you forget to close the lid of your toilet, the splatter from the flush spreads the fecal matter all over. You won't be able to see it, but microscopic droplets can scatter as far as 6 feet. After using your brush, let it dry and store it in the medicine cabinet. Make sure you open the windows of your bathroom for proper ventilation. Drying your brush in sunlight is also an effective way to get rid of bacteria. Number 4, individual covers. It's okay to use covers for your brush as long as they're clean. Clean them once every 2 weeks to get rid of the bacteria. You can use disinfecting soaps and solutions or simple wipes to clean them off. Number 5, toothpaste dispenser. There's always a risk of cross-contamination with toothpaste that comes in tubes. The nozzle of the tube may touch other brushes, transferring bacteria from one to another. Using a toothpaste dispenser is a smart choice to avoid cross-contamination. When to replace your toothbrush. Throw your brush in the bin if you've been using it for more than 3 months. If you use a brush twice a day, that's close to 200 brushing episodes in 3 months. It's around this time that the bristles will be bent permanently. This is when you buy a new toothbrush. These are the pre-COVID instructions for a healthy toothbrush. Now let's discuss what can be done after you've recovered from COVID-19. Studies have shown that the main route of COVID is through droplets. Coronavirus is in your saliva. When you brush your teeth, chances are it will be transferred to your toothbrush. Doctors advise you to replace your toothbrush after you've recovered from the virus. This will drastically reduce the chances of spreading the virus to your family members. The methods we've discussed are not as effective in the case of coronavirus. If possible, change your tongue cleanser and flosser along with your brush for maintaining extra hygiene. This should stop the spread of infection even if you're suffering from a sore throat, flu, or cold. If you've recently been diagnosed with COVID-19, do not use the family toothpaste. Get a separate tube of your own and toss it once you've recovered. Regular mouthwash with antibacterial rinse will help you get the viral load under control. Do you feel like your gums are getting smaller? This has to do with your brushing. Learn how to treat your receding gums at home naturally. Is your brush stained with blood even after brushing lightly? Here are 16 expert techniques for stopping your bleeding gums. Go ahead, click one, or better yet, watch both and learn more about how to become healthier. How do you keep your brush clean? Let us know in the comments below.